Hey, good morning and welcome to UroPatient. I'm your host, Vic Senese. Nice to have you on board here today. We got a great show for you today, but hey, do me a favor and hit that like and subscribe button. Keeps us busy. So today we're going to have a great show. I'm going to be talking about varicocele. If you never heard of what a varicocele is, I'm sure you've probably heard the name or the term varicose veins. So we're going to talk about what a varicocele is when it's a varicose vein in the scrotum and how it can affect a man. Now, I've been working on some different types of formats on presentations and came up with something where I can kind of create these movies, these little mini clips, educational clips. So let me know how you like them in the comments. But that's what we're going to do today to do my description. So here we go.
Right, let's talk about something that affects millions of men, but a lot of guys don't even know they have it. The topic is varicoceles. So whether you're just curious or you've recently been diagnosed, we're going to break down exactly what you need to know step by step. And that quote really gets to the heart of it, doesn't it? This is not some rare, obscure condition. It's actually incredibly common. But because the symptoms aren't always screaming at you, a lot of men can go their whole lives without ever knowing it's there. So here's our game plan. First, we'll get into the basics of what a varicocele actually is. Then we'll talk about why they happen and just how common they are. After that, we'll look at how they can affect your health, check out the treatment options, and finally, what to expect with recovery. Okay, let's dive right into part one. So what exactly is a varicocele? In the simplest terms, it's kind of like a varicose vein, the kind people get in their legs, but it's in the scrotum. These veins are supposed to carry blood away from the testicles. And when they get enlarged and swollen, well, that's what we call a varicocele. Now, you're going to hear this description a lot, and I know it sounds a little strange, but doctors often describe the feeling of a varicocele as a bag of worms. It's just a memorable way to explain that kind of lumpy, tangled sensation someone might feel during an exam. So what's really going on here? Well, think of it like a plumbing problem or a traffic jam. The blood is supposed to be flowing smoothly out and away, but instead it gets backed up. It pools in those veins, which causes them to stretch out and get bigger. This brings us to a couple of really logical questions, right? Why does this happen in the first place? And are you the only one dealing with it? Just how common is this? The truth is, we don't know the single exact cause, but we have some really strong clues. Inside these veins are tiny little one-way valves. If they stop working right, blood can flow backward and pool up. Anatomy also plays a huge part. The vein on the left side joins up with a bigger vein at a really sharp angle, which can make it harder for blood to drain. And that's exactly why most varicoceles, up to 90% of them, are found on the left side. And here's the number that might surprise you. Up to a quarter of all adult men have a varicocele. So if you've been diagnosed, I want you to know you are absolutely not alone. This is an incredibly common thing. Okay, now we're getting to the real heart of it. For a lot of guys, a varicocele causes zero problems. But for others, it can have a real impact. So the big question is, should you be concerned? Let's break that down. Now, it's important to know this isn't a life-threatening condition. But what it can do is mess with how the testicles work in a few important ways. These are really the four main areas to think about. For some guys, there's a dull, aching pain, especially after standing a long time. It can also affect the health of the testicle itself, sometimes even causing it to shrink. And the two big ones are its link to lower testosterone levels and probably most famously, male infertility. And that connection to infertility is a really big deal. Just look at this chart. When you look at men who are having fertility problems, about 40% of them are found to have a varicocele. This actually makes it one of the most common and, importantly, reversible causes of male infertility. So, if a varicocele is causing pain or maybe it's a factor in fertility issues, what are the next steps? Well, the good news is, there are very effective treatments available. The main solution is a procedure called a varicocelectomy, and the whole goal is pretty simple. A surgeon goes in and ties off those faulty, enlarged veins. This reroutes the blood flow into healthier veins, which solves the whole pooling problem and helps fix the negative effects. But here's something you really need to know. Not all surgeries are created equal. On the left, we have the modern gold standard, microsurgical repair, which uses a high-powered microscope. You can see the recurrence rate is incredibly low and pregnancy rates are higher. Compare that to older methods on the right, well, the difference in outcomes is pretty dramatic. And that leads us to our last section, which is often the most important question for any patient. So what happens after the treatment? What are the results really like, and what about the recovery? Let's start with the impact on fertility because the results here are pretty incredible. Major studies have found that after the repair, the odds of a couple getting pregnant increase by a factor of almost 2. This chart really shows you that powerful jump. It's a clear, significant benefit. And it gets even better. It's not just about conceiving, it's about the ultimate goal of a live birth. The chances of that happening are nearly 3 times higher after a varicocele repair. For couples trying to start a family, that is an absolute game changer. And what about hormones? Well, for men whose low testosterone is linked to their varicocele, the improvement can be huge. Studies show that the vast majority, we're talking up to 80% of men, see their testosterone levels come right back into the normal range after the procedure. Finally, let's talk recovery, because everyone wonders about that. It's actually a really straightforward process. First off, it's an outpatient procedure, so you go home the very same day. Most people are back to work or school within about 3 days. You'll have to take it easy, no heavy lifting for at least 2 weeks, and while you might have some tenderness for a bit longer, the road to full recovery is generally pretty quick. So, we've walked through what a varicocele is, the impact it can have, and the really effective treatments we have today. This just leaves one final question for you to think about. If you're dealing with any of these issues, pain, low testosterone, or challenges with fertility, it's worth asking, could treating a varicocele be an important part of your health journey? Make sure you have that conversation with your doctor. Thanks for joining me.
Yeah, so I think that was to me that was a pretty educational video and did at least as good as job as I could have done, maybe better. But if you got a varicocele, that's one of those things that sometimes it's you're having infertility issues. That can be great because the repair is fairly simple and the results are dramatic. I mean, in my career, I've seen many couples go on to have children after varicocele repair. So don't fret too much about it. All right. Well, I hope you enjoyed that. Now, next week, are you struggling with recurrent UTIs that just won't go away? Well, you're not alone. And there are answers. Next week on UroPatient, I'm going to break down why urinary tract infections keep coming back and what you can actually do to stop the cycle. From prevention strategies to treatment options at work, this episode is going to deliver practical, patient-friendly guidance you won't want to miss. So if you're tired of the discomfort, the frustration, and the repeat antibiotics, make sure you check this episode out next week on UroPatient.com. So we'll see everybody next week. Have a great day. That weather's going to be starting to change. I think we're getting into spring for sure. So enjoy the weather.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.